Hello my dear friends, now we are going to start with the topic of upper limb, and in the upper limb topic, the very first topic that we are going to learn is brachial plexus. Now guys, you have to actually know what is the meaning of plexus. Remember, plexus means network. Now you will be coming across this word many times in your entire MBBS, like lumbar plexus, pampiniform plexus. So wherever you come across the word as plexus, remember it is network. And here in the brachial plexus, it is actually the network of nerves, and from that brachial plexus you'll be getting like multiple branches and all, and they are going to supply to all the muscles in your arm, forearm and the hand, guys. Understanding? So brachial plexus is nothing but the network of nerves. In this, the first thing that you have to learn is origin of the brachial plexus. Brachial plexus, remember, it is originating from ventral rami of C5 to T1. Ventral rami of C5 to T1. It's originating from ventral rami of C5 to T1. Now in this, first of all, let us try to understand what is this C5 to T1, guys. So I hope you have learned about the cervical spinal nerves, the thoracic spinal nerves and all. So there will be totally like 8 pairs of cervical spinal nerves and there will be 12 pairs of thoracic spinal nerves. And out of all those spinal nerves, what is going to happen? Somewhere in the middle here, there will be C5. So C5, C6, C7 and C8 and the first thoracic. That is your T1. From here originates your brachial plexus. So brachial plexus originating from C5 to T1. And you don't have to worry about the ventral rami. When you study about the spinal cord, in the spinal cord you'll be able to find that there will be 2 rami. There will be a ventral rami and a dorsal rami. And we all know that the plexus is actually contributed by the ventral rami. Ventral rami is the one which is actually helping you in the formation of plexus, guys. So I repeat for the last time, what is the origin of the brachial plexus? It is originating from ventral rami of C5 to T1, guys. Now once you are done with the origin, remember there are totally like 5 parts of brachial plexus. Now what are the 5 parts? Start learning about them. First of all, you'll be having roots. The roots will combine to form trunk. The trunks will be dividing into divisions. Divisions will combine to form cords, and cords will finally give you the branches. So roots, trunks, division, cords and the branches. These are the 5 parts of the brachial plexus, guys. Now let me just show you the diagram here. I think you have seen this diagram of brachial plexus thousands and thousands and thousands of times in your life. So there are like so many nerves here. It's a complicated network like structure here, guys. But one thing which I want all of you to appreciate here, that sometimes what will happen is that even C4 will also contribute for brachial plexus, guys. Not always. Sometimes even C4 will also contribute. If this C4 will contribute, then this plexus is actually referred to as prefixed plexus. If the C4 also contributes, then it is known as prefixed plexus, guys. And appreciate one more thing here. Sometimes even T2 will also contribute, sir. If T2 contributes here, then it is known as what? Post-fixed plexus. But I am repeating it again, guys. Remember, it's not always. Okay. So if C4 is contributing, it is known as prefixed plexus. If T2 will also contribute, then it is known as post-fixed plexus. Now, apart from this, you are able to see all the 5 parts of the brachial plexus there in this diagram. But my dear friends, remember, in our entire anatomy, I am going to make you draw the diagrams. Is it okay? We are not going to use these ready-made diagrams in the textbooks. So let us draw the diagram so that you get more confidence and easy to learn anatomy, guys. So let's draw this one. First of all, do one thing. Write down all the 5 parts on the top of your page there. Roots will combine to form trunks, will divide into divisions, and then divisions will combine to form cords, and cords will finally give you the branches. Now out of these 5 parts, let us learn all these parts one by one. Out of these 5 parts, guys, roots is the easiest one, and you already know about that one. How come you know that one? Whatever origin that we have learned just now, that is ventral rami of C5 to T1, that itself is nothing but the root, guys. Understanding? So therefore, roots are formed by ventral rami of C5, C6, C7, C8 and T1. So it's very much easier, guys. Now these roots will actually combine to form the trunk. And how many trunks do you have? You'll be totally having like 3 trunks. There'll be upper trunk, middle trunk and lower trunk. Let me tell you how these trunks are actually formed here. Now out of this, first of all, combine the upper 2, that is your C5 and C6. These 2 will combine to form upper trunk. Then combine the lower 2, that is your C8 and T1. These two will combine together to form your lower trunk. And lastly, we are left out with C7. C7 will just continue here to form your middle trunk, sir. Oh, that means we'll be just having how many trunks, sir? 3 trunks. Upper trunk, middle trunk and the lower trunk. Now the next one will be your division here. And I love this part. Why? Because this is the easiest part in the brachial plexus. And in the entire brachial plexus, the easiest part is the division, guys. Why? Because all the 3 trunks, that is your upper trunk, middle trunk and the lower trunk, all the 3 trunks will be dividing into 2 division. One is anterior division, another one is posterior division. So no confusion, no tension at all. So let me draw the anterior division with the black color here. So these are the anterior divisions. And then this will be the posterior divisions here, guys. So what's happening here? Basically, like all the 3 trunks, that is your upper trunk, middle trunk and lower trunk, are dividing into 2 division. One is anterior, another one is the posterior division, guys. And now I want all of you to be like more alert, guys. Chords. Most of the students will be confused in this chords only, guys. But try to learn this in my way. I'll tell you in the easiest manner possible. Look here. Guys, this one here is the posterior division of the upper trunk. And this here will be the posterior division of the middle trunk. And this here will be the posterior division of the lower trunk. Combine all the 3 posterior divisions. First, what you're going to do? Combine all the 3 posterior divisions. Together, it is going to form your posterior chord. Okay. First, you combine all the 3 posterior divisions. Together, it is going to form the posterior chord. Then, the anterior division of the upper trunk and the anterior division of the middle trunk, these two will combine together to form your lateral chord. So out of the 3 anterior divisions, be careful here. Just combine the anterior division of the upper trunk and the middle trunk. Those two will combine together to form lateral chord. And finally, the anterior division of the lower trunk will just continue here. It will continue to form your medial chord. So in total, how many chords do you have, guys? You'll be having like 3 chords. There'll be a posterior chord, then the lateral chord and the medial chord. Perfect. Now before moving ahead, I want to tell you one more thing here, guys. Try to do one thing. We have actually drawn this diagram like in your books there. Fine. But let us try to apply this diagram on our body. Let's see exactly where it is present. You know? So somewhere here you'll be having your C5 to T1. That is the roots here. Roots will combine to form trunks here. Then there will be division. And divisions will further actually be combining to form your chords. So basically, where are the chords present? The chords are actually present in the axilla here. Okay. Now what I am trying to tell you here is that the nomenclature of these chords, the naming of these chords, the lateral chord, and then there is a medial chord and posterior chord. So these names are given with respect to what? That was actually asked in your exam. So remember, in the axilla here, you'll be actually having the axillary artery, and all these 3 chords are named with respect to the axillary artery. For example, you just imagine here, axillary artery, and one of the chord is lateral to that, lateral chord. One of the chord is medial to that, medial chord. And one of the chord is actually behind that, that is posterior chord, guys. Understanding? So all the 3 chords are named with respect to what? With respect to axillary artery. That's important. Now, if you people are interested, let us learn in a little bit more depth. Later on, I'll also teach you about the axillary artery, guys. Remember, axillary artery is actually in turn divided into 3 parts. There'll be first part, second part, and third part of the axillary artery. And in one of the exams, they have even asked, chords are named with respect to which part of the axillary artery? Which part of the axillary artery? So remember, second part. So all these 3 chords, they are named with respect to the second part of the axillary artery, guys. Clear? So that is what I want you to understand here before moving ahead, guys. And now if you're looking at the diagram here, in this diagram, we are actually done with all the 4 parts. We are done with the roots, the trunks, the division and the chords. And the only thing that is left out right now is branches. Okay? So let's get started with the branches. Whatever branches are given from the chords, all these branches I'm going to first of all teach you with the help of mnemonics. Lateral chord will actually give you 3 branches, and those 3 branches we are going to learn as LML branches. LML branches. Medial chord will give you totally 5 branches, and we are going to learn with the mnemonic as M4U. So there will be like 4 M's and U, M4U. So lateral chord will give 3 branches, LML. Medial chord will give you 5 branches, M4U. And posterior chord will also give you 5 branches. Remember with the mnemonic as lunar. Lunar branches, guys. And now we are going to write down their full names there. And do one thing, guys. Write down the names along with me. and keep on repeating that in your minds, because branches here, there is nothing like a concept part here or something like that. So first you try to learn the branches, and later on the things will become easier, guys. So in this LML, L stands for lateral pectoral nerve. L for lateral pectoral nerve, guys. And then M stands for musculocutaneous nerve. Musculocutaneous nerve. And then one more L here stands for lateral root of median nerve. Lateral root of median nerve here, sir. So LML, L stands for lateral pectoral nerve, M for musculocutaneous nerve, and one more L stands for the lateral root of the median nerve, guys. Done. Now after learning the lateral cord branches, LML branches, immediately learn the branches given by medial cord. I'll tell you the reason why. Look at that L, guys. In LML, look at that L. L for lateral pectoral nerve. It makes sense. If there is a lateral pectoral nerve, there should be a medial pectoral nerve also. You know? So out of this M4U, one of the M stands for medial pectoral nerve, sir. Medial pectoral nerve. Again, look at that LML. In that, one more L actually stands for lateral root of median nerve, guys. If there is a lateral root, there has to be a medial root. So therefore, one more M stands for the medial root of median nerve. Now here, I want all of you to appreciate one thing. Suppose, if I ask you like, what is the origin of median nerve? Median nerve is beginning from where? Median nerve is actually starting from where? So look here carefully, guys. Don't do this in your books actually. Don't spoil your diagram. Lateral root of the median nerve coming from the lateral cord, and the medial root of the median nerve coming from the medial cord. Both of them will combine together to form your median nerve. So basically, median nerve is originating from where? It's originating from both your lateral cord as well as medial cord. It's beginning from both lateral cord as well as the medial cord, guys. Understanding? So what I'm trying to tell you is that directly or indirectly, we are even learning what, guys? We are even learning the origin also, the branch. It's branching from where? It's beginning from where? Understanding? So median nerve has got dual origin. It's originating from the lateral cord as well as the medial cord. Similarly, if I ask you like musculocutaneous nerve is originating from where? Musculocutaneous nerve is originating only and only from the lateral cord, LML. So please try to keep an eye, directly or indirectly, we're even learning the origin of these branches here, sir. They're beginning from where? So later on, it is going to help you a lot. Now let's continue with the branches here. In M4U, we are done with two M's there. Lateral pectoral, medial pectoral, lateral root of the median nerve, and there'll be a medial root of the median nerve, guys. Done. Now what about the remaining two M's here? They are very much easy. First of all, you write down the name along with me. M stands for medial cutaneous nerve of arm. And one more M here stands for medial cutaneous nerve of forearm. Wow. I don't even have to teach you here, and you don't even have to learn here. It's there, everything in the name itself, guys. So what is the meaning of cutaneous? Cutaneous is nothing but the skin here. Medial cutaneous nerve of the arm and the forearm. That means these two are the branches which will be supplying to the skin on the medial side of the arm here and skin on the medial side of the forearm here, sir. The skin on the medial side of the arm, medial cutaneous nerve of the arm, and skin on the medial side of the forearm, guys. And lastly, U stands for ulnar nerve. Every medical student knows that. It's one of the famous one. U for ulnar nerve. And again the same thing, guys. Keep an eye on the origin. Ulnar nerve is originating from where? It is beginning from where? It's beginning from the medial cord of the brachial plexus, guys. Now we are done with LML, we are done with M4U. Let's go to the last and final thing, that is a posterior cord branches. In the posterior cord, you'll be having lunar, L for lower and U for upper. Lower and upper subscapular nerve. So basically there are like two nerves there. One is the lower subscapular nerve, another one is the upper subscapular nerve. The next one, N, stands for nerve. Nerve to a muscle. The name of the muscle is latissimus dorsi. Nerve to latissimus dorsi muscle. Now I hope you have seen this muscle a lot of times. I'm speaking about this one here, guys. This is your latissimus dorsi muscle, guys. It is the broadest muscle in our body. Be careful, I'm not telling the largest muscle. Largest muscle is gluteus maximus. We'll study that later on in the lower limb. Broadest muscle in our body is latissimus dorsi. Now look at that huge muscle, guys. Okay, for example, if you go to a gym, In the gym, there will be a rod. You hold the rod and you're like moving up and down. And when you're moving up and down, this muscle develops very nicely, giving your body a complete V shape there. Now, because this muscle is actually helping in moving like up and down there, like climbing, that's the reason why, remember, latissimus dorsi muscle, it is also known as the climber's muscle. I request all of you to please write it down somewhere else in your books. Latissimus dorsi muscle, it is also known as climber's muscle. Now, what is the nerve supplying to latissimus dorsi? Simple, nerve to latissimus dorsi. Nerve to latissimus dorsi. And that nerve is actually passing from here. And it is behind the thorax. So, thoracodorsal. So, what is one more name, another name of latissimus dorsi muscle? Nerve to latissimus dorsi, sorry. Another name of nerve to latissimus dorsi will be the thoracodorsal nerve. And I told you not to mug up that one, sir. Learn it in an easy manner. Yes, behind the thorax, thoracodorsal nerve. And then AA stands for your axillary nerve here. And then R stands for the radial nerve here, sir. So A for axillary nerve and R is actually the radial nerve. It is the largest branch of the brachial plexus. And that completes all the branches from your cords. The lateral cord, medial cord and the posterior cord, guys. LML, M4U and the lunar. But hold on, guys. Don't think that all the branches are completed here. Why? Because in brachial plexus, the branches are given from three places, sir. Number one, the branches are given from cords. And that we have already completed. All the branches from the cords you can see there on the screen there, guys. We are done with all the branches from the cords. Next, number two, we also get the branches from the trunk. How many trunks do we have? We have like three trunks: upper trunk, middle trunk and the lower trunk. The good news here is that out of the three trunks, the middle trunk and the lower trunk will not give any branches. Only the upper trunk will give the branches, guys, okay? So don't panic here. Only upper trunk will give, and that too only two branches, sir. So let's see here. So middle trunk and the lower trunk will not give any branches. Upper trunk will just give you two branches here, sir. Now what are the two branches given here? One will be the suprascapular nerve. Suprascapular nerve. And another nerve will be nerve to subclavius. Nerve to subclavius muscle. Guys, concentrate on that word subclavius. Sub, below. The word clavius is actually coming from the clavicle. So below your collarbone, clavicle here, you'll be having a small muscle and that is subclavius muscle. Nerve supplying to that one will be nerve to subclavius. Simple. Is it okay? So upper trunk will give you two branches, suprascapular nerve and nerve to subclavius. Now apart from that, remember, you also get the branches from roots also, guys. The last and final one. And from the roots also, you'll be getting like two branches. From the roots also, you'll be getting two branches. Let's see that. Number one, there will be a branch from C5, the ventral rami of C5. That will be the dorsal scapular nerve. I want all my students to be like really careful with this scapular. We have got subscapular, we have got suprascapular, and then we have got the dorsal scapular, guys. And from C5, it is dorsal scapular. Be careful with that. And then from C5, C6 and C7. So all the three of them will actually contribute here. We'll be getting a branch. And this one is said to be the long thoracic nerve. Long thoracic nerve, guys. And this nerve, it is also known as the nerve to a muscle. The name of that is serratus anterior. So long thoracic nerve is the one which is supplying to serratus anterior muscle. And that is the reason why it is also known as nerve to serratus anterior. One more name, remember, it is also known as nerve of Bell. Nerve of Bell, guys. So long thoracic nerve or nerve to serratus anterior or nerve of Bell. Let me show you this muscle once. I think you have seen this muscle, guys. Serratus anterior muscle will be actually originating from the upper 8 ribs, like first to 8th rib. First to 8th rib, guys, and it will be actually attached to your thoracic wall here, and finally it will go and get inserted onto the scapula, the medial border of the scapula. Now what I'm trying to tell you here, that serratus anterior muscle will be actually helping in punching and pushing movement, guys. Punching and pushing movement. That's the reason why this serratus anterior muscle, it's also known as the boxer's muscle. Please make a note of that somewhere else. Serratus anterior muscle, it is also known as the boxer's muscle, helping in punching and pushing movement, guys. What is the nerve supplying to that? We have learned that long thoracic nerve or nerve to serratus anterior or nerve of Bell, guys. And by this, we complete the entire entire brachial plexus. The origin, all the 5 parts, that is your roots, trunks, division, cords, and finally the branches. And branches are given from where? The branches are given from the cords also, then the trunk also, as well as the root, guys. Now here itself, let me tell you one important question which was recently asked in the AIMS exam. In AIMS exam, they've actually asked about, like, all of the following will give the branches in brachial plexus except one. All of the following will give the branches in brachial plexus except what, sir? Just look at my diagram here. Are you getting the branches from the roots? Yes, of course. Are you all getting the branches from the trunk also? Yes, of course. From the upper trunk we are getting. And are we getting the branches from the cords? Of course. LML, M4U, lunar, all are the branches from the cords only. The only one which will not give any branches will be division. This was the question which was given in the AIMS exam. So that's why brachial plexus is one of the important topics, sir. They'll be asking questions every now and then from here. So all the parts will give the branches except the division. Division will not give any branches there, guys. Now after completing the entire brachial plexus, one more thing that we have to learn is about the root value, sir. Yes, even that is also asked in the exams. So let us work out on the root values right now, guys. Let's speak about the root values now. Now to learn this, we'll do one thing. We'll quickly draw the diagram of brachial plexus once more, guys. So first of all, the roots, ventral rami of C5, C6, C7, C8 and T1. C5 and C6, these two will combine to form upper trunk. C8 and T1, these two will combine to form the lower trunk. And C7 will continue as middle trunk. All the 3 trunks will divide to anterior division, posterior division, anterior division, posterior division, anterior division and the posterior division. The posterior division of the upper trunk and the middle trunk and the lower trunk will combine together to form posterior cord. The anterior division of the upper trunk and the middle trunk will combine to form the lateral cord, and then the anterior division of the lower trunk will continue to form your medial cord. So it is just going to continue to form your medial cord. Lateral cord will give you 3 branches, L, M, L. Medial cord will give you 5 branches, M, 4, U. And then posterior cord will give you the lunar branches. Look at the way how simply we have made the diagram right now. That's what I'm trying to tell you. Don't try to learn from that ready-made diagrams in the textbooks and all. Listening to this entire video, try to just practice the diagram twice or thrice, guys. Brachial plexus will become perfect for you. Okay. Now welcome to the root values. What is the root value of this LML branches? Remember, their root value will be C5, C6, C7. Sir, how come? I'll tell you the trick here, sir. Remember, how is this lateral cord formed here, sir? The lateral cord is formed by anterior division of upper trunk and it is formed by the anterior division of the middle trunk. And we all know upper trunk is formed by C5 and C6 and the middle trunk is formed by C7. Wow, it makes sense now. That means all that 3 branches L, M, L, they are getting the contribution from C5, C6 and C7. That is why their root value is C5, C6 and C7, guys. Now similarly, apply the same logic and find out what is the root value of medial cord branches, M4U. Medial cord will be the continuation of anterior division of lower trunk. And lower trunk is formed by C8 and T1. We all know that the lower trunk is formed by C8 and T1. So therefore, its root value will be actually C8 and T1, guys. But here, I want all of you to remember the ulnar nerve. Why? Why? Because it's an exception there. Ulnar nerve will also have the root value of C8 and T1, guys. But remember, it is getting additional contribution from C7 also. And you all know very well, wherever you have exception, there you can always expect a question, guys. Okay. So already it has been asked in almost many exams. So ulnar nerve is actually having the root value of C7, C8 and T1. C7, C8 and T1. Now this is easy. Welcome to the last and final one, that is your posterior cord, guys. Lunar branches. Now what will be the root value of this posterior cord branches? If you look at the diagram, externally it looks like, posterior cord is getting the contribution from all of them. Look at it. Look at the diagram carefully, guys. So posterior cord, it's actually getting the contribution from all of them, like C5 to T1. Fine. But Please be more alert right now. Lower subscapular, upper subscapular and axillary. I repeat again, lower subscapular, upper subscapular and axillary. These three, their root value is only C5 and C6, guys. Sir, what does that mean? It means that it is not like external, guys, it is actually internal. Internally, what is happening? Only the fibers, nerve fibers which are coming from C5 and only the fibers which are coming from C6. These are the one which are contributing for lower subscapular, upper subscapular and axillary. Hope you are getting me. So it's not external, it is actually internal. Internally, what is happening is that only the contribution is coming from C5 and C6, guys. Understanding? So it is absolutely possible. See, even though all the divisions are combining to form the posterior cord, it is not necessary that all the neurons should contribute. So internally, only C5 and C6 is contributing to lower subscapular, upper subscapular and axillary. That is why its root value will be C5, C6. The next one here will be the nerve to latissimus dorsi. Oh my god, this is like much more dangerous. Why? Because it is getting the contribution from the middle three, sir. C6, C7 and C8. So nerve to latissimus dorsi is getting the contribution from C6, C7 and C8. And the last and final one, that is your radial nerve. And radial nerve is the largest branch of the brachial plexus. And it is the one which is getting the contribution from all the roots C5, C6, C7, C8 and T1. It is the one which is getting the contribution from all the roots, guys, C5 to T1. That's the reason why I always tell the students to please concentrate and learn the root values of posterior cord branches. Lunar branches, be careful there, guys, root values. Lateral cord branches, root values are very simple. You can tell that any point of time. Even the medial cord is very simple. You can tell that any point of time. But posterior cord, keep on revising that one, guys. There are chances of getting confused there. And that completes your entire, normal brachial plexus here. So we are done with the origin. We are done with all the 5 parts, that is roots, trunks, division, cords and branches. And we have even seen the root values also. Now, after completing all these things regarding the brachial plexus, let me do one thing, guys. Let me just show you certain questions which were actually asked in the previous exams. And let us try to clarify certain controversies here, guys. In one of your exams, there was a question asked, like which of the following is a branch from trunk of brachial plexus? So which of the following is a branch from the trunk of the brachial plexus? One of the option was given as suprascapular nerve, and another option that was given was nerve to subclavius. There is a reason why I'm actually making you write down this question here, guys. So now read the question very, very carefully. Which of the following is a branch from the trunk of the brachial plexus? Trunk of the brachial plexus. Just now I taught you we are actually having like 3 trunks, and out of the 3 trunks, only upper trunk will give you the branch. And upper trunk will actually give you like 2 branches there. One is suprascapular, another one is nerve to subclavius. And in the exam, what happened, both of those branches were given in the option. I hope now you're understanding my intention here. So we don't need that like other options there, guys. What is my intention here? What I'm trying to tell you is that, yes, in the class, actually, like the faculty, we taught you that upper trunk will give you like 2 branches, suprascapular nerve and nerve to subclavius. But in the exam, they have given like both the branches in the option. Now what to do with these kind of things? Look here. I will tell you exactly what is given in the Gray's Anatomy, 41st edition of Gray's Anatomy. C5 and C6, these two will combine together to form your upper trunk. Upper trunk will be dividing into anterior division and the posterior division. And upper trunk will actually give you a branch that is nerve to subclavius. I'll just write down here as B, that is option B there. Upper trunk will give nerve to subclavius. Fine, no confusion about that. Now what's written in the Gray's Anatomy, listen carefully, I'll just read out the exact words from the Gray's Anatomy. What is written there is, suprascapular nerve is also a branch of upper trunk. Suprascapular nerve is also a branch of upper trunk. But most frequently, concentrate there, most frequently it springs from the ventral rami of C5 here. That is option A, that is suprascapular nerve. Most frequently it is coming from where? The ventral rami of C5. Even though both of them are the branches of upper trunk only, but there is a statement given there. Most frequently it is coming from ventral rami of C5. I hope you are getting it. So then what should be the answer? If this type of questions are given, then the better answer from the trunk will be nerve to subclavius. So out of that both the options, both the branches, better answer will be nerve to subclavius. Hope the controversy has been clarified. Next, one more question, guys. Have you ever heard about accessory phrenic nerve? There was a question asked regarding the accessory phrenic nerve, guys. It's a branch of which one? I mean to say, accessory phrenic nerve is a branch of which one, guys? So just now I told you about nerve to subclavius. You just imagine here, this one will be your nerve to subclavius here. Just an imaginary diagram, nerve to subclavius. And we also know about the phrenic nerve. Phrenic nerve is the one which will be supplying to diaphragm. And phrenic nerve will be originating from where? It is beginning from C3, C4 and C5. So it will be beginning from C3, C4 and C5, and the phrenic nerve will be going down to diaphragm. Fine. Now remember, nerve to subclavius will be sometime giving off a branch, and that branch will be going and joining here like this. And this one here will be your accessory phrenic nerve, if present, not always. So accessory phrenic nerve is also given by nerve to subclavius, and that will actually be going and joining with the phrenic nerve. Just for the sake of understanding, we are drawing a schematic diagram here, guys. Understanding? So there will be a nerve to subclavius, and nerve to subclavius will give rise to accessory phrenic nerve. Even this was asked in your exam. So there are some interesting questions regarding nerve to subclavius. Be careful with that one. So two important things I told you. Number one, accessory phrenic nerve is given by nerve to subclavius. Number two, remember, it is the actual branch which is actually coming from upper trunk. If both the options are given in the exam, like suprascapular nerve and nerve to subclavius, better option will be like nerve to subclavius, guys. It's okay. So these are like certain important things which I wanted to discuss regarding the brachial plexus, which has been asked in your exam recently, guys. So that actually completes the normal brachial plexus. We have completed like the origin, all the 5 parts, the root, trunk, division, cords and branches. Then we have seen the root values, and certain controversies has been clarified here, sir. Now after completing this normal brachial plexus, now let us learn about the injuries in the brachial plexus. I mean to say, we are going to learn about the applied aspect of that one. So now we are going to learn about the applied aspect of the brachial plexus, guys. In this, first of all, what is Erb's point? Just now we have learned about the brachial plexus. In the brachial plexus, what is or where do you have the Erb's point, guys? Remember, Erb's point will be located exactly where you have your upper trunk. Okay, Erb's point is that point where you have your upper trunk, guys. There was a question asked in the exam, and that was like, how many nerves are going to meet at the Erb's point? How many nerves are going to meet at the Erb's point? Let's see that. C5 and C6, these two will combine together to form your upper trunk. Upper trunk will be dividing into anterior division and the posterior division. And then upper trunk will also give like 2 branches. One is suprascapular nerve, another one is nerve to subclavius. Now let us just see. Number 1, there will be C5. Number 2, you will be having C6. Number 3, there will be suprascapular nerve. And number 4, there will be nerve to subclavius. Number 5, there will be anterior division. And number 6, there will be posterior division. So in total, how many nerves are going to meet at the upper trunk? So you can clearly see in my diagram here, there are totally 6 nerves meeting at the upper trunk, and that itself is nothing but the Erb's point. So how many nerves are going to meet at the Erb's point, sir? 6 nerves meet at Erb's point. 6 nerves will meet at the Erb's point, guys. Simple stuff. Now unfortunately, what is going to happen in some people, that upper trunk will be actually damaged, injured. And if that is injured, what will happen? Whatever muscles are supplied, those muscles will undergo paralysis. And that is the reason it is known as Erb's paralysis. So one of the most important topic, very high yield topic for your exam, sir. So Erb's paralysis. First of all, write down there, guys, what is the meaning of Erb's paralysis? Erb's paralysis is injury to upper trunk of brachial plexus. So what is os paralysis? Os paralysis is basically injury to the upper trunk of the brachial plexus, guys. Question number 2. What is the nerve root involved? What is the nerve root involved? Now my students are expert now. Just now we have seen the normal brachial plexus. You all know what is the root value that is involved here in os paralysis, sir? That is C5 and C6. Then which nerves are mainly involved here, guys? Which nerves are mainly involved in the os paralysis? Number 1, axillary nerve. Number 2 will be your musculocutaneous nerve. Musculocutaneous nerve. And number 3 will be the suprascapular nerve. So these are the 3 nerves that you have to remember, which are like mainly involved in the os paralysis, guys. I repeat again, axillary nerve, musculocutaneous nerve and suprascapular nerve are mainly involved in the os paralysis. The next thing here, like what is the cause, guys? So that's what I'm telling here. Write on the notes very clearly, guys. Whatever notes I'm giving you here, it's like every point is like one MCQ there, sir. So what is injury to upper trunk? Os paralysis. What is the nerve root involved? C5 and C6. What are the nerves involved in os paralysis? Axillary nerve, musculocutaneous and suprascapular. Now what will be the cause of os paralysis? Number 1, it can be due to a birth injury. Like how is it possible? Now during delivery, during the birth, what will happen? The first thing to come out will be the head of the baby. Now sometimes there will be certain complications, like the head of the baby will come out but the shoulders are still stuck inside. Now if the doctor is like experienced doctor, they knows very well how to handle such kind of complications. But suppose if there is an inexperienced doctor, then what will happen? They'll just try to hold the head and just try to keep on pulling it out, sir. So they're trying to hold the head and just trying to pull it out, whereas the shoulders are still stuck inside only. So because of this, what will happen? There will be a overstretch between the head and the shoulder. Between the head and the shoulder, there will be like overstretch. And now we are like very much expert now. We have just learned the anatomy of brachial plexus here. And we know that somewhere in the middle, C5 and C6 will combine to form your upper trunk here. It will be here only, guys. So if there is an overstretch between the head and neck, what is going to happen? The upper trunk will be damaged. So therefore, injury to upper trunk that is leading to os paralysis can occur due to birth injury, guys. Due to birth injury. Overstretch between the head and the shoulder. One more reason for os paralysis will be fall on shoulder. Fall on shoulder. Sometimes what will happen, players, like football players and the cricket players, they'll be falling very randomly. And when they fall down very randomly, sometimes they'll be falling on the shoulder. And again, the same reason there's an overstretch between the head and the shoulder, injury to upper trunk, guys. After learning the cause, the next important thing is what is the sign of os paralysis. All these things are like, okay, guys, but what is a sign? What is a sign? How will you clinically identify os paralysis? That is important now. So let me tell you how are you going to identify that one, guys. Suppose if this upper trunk is gone, then what is going to happen? First of all, at the shoulder joint here. Okay. So remember, your shoulder or your arm here will be like adducted. It will be adducted and medially rotated. It is adducted. Okay. Moving away is nothing but abduction. Moving towards is nothing but adduction. So it is adducted and medially rotated. Okay. Then the next thing will be at the elbow. You just try to learn like step by step. So what is going to happen? The next thing is elbow. Elbow, will it be like flexed or extended? It will be extended. And then the forearm will be like supinated or pronated. It will be pronated. And then finally, these fingers are actually flexed. So that completely will give the appearance of a policeman tip hand here like this. So I repeat again, arm will be like adducted and medially rotated. Elbow will be extended. The forearm will be pronated and the fingers are actually flexed. Let me show you a picture for this one here. So let us write down the sign here, guys. So what's happening at the arm here? So arm will be adducted and medially rotated. Next is elbow. What's happening at the elbow, guys? Elbow is extended. And the next thing will be the forearm here. Remember, the forearm will be pronated. And you can see the fingers flexed there. Is it fine? So arm, you actually have to know like in sequence, guys. The arm will be adducted and medially rotated. Elbow is extended, the forearm is pronated and the fingers are flexed. And overall, it is giving the appearance like a policeman tip hand, as if though the policeman is taking a tip. And it is also known as the waiter's tip hand. Sometimes what will happen, the waiters will also come and take the tip from behind. And it is also known as the porter's tip hand. So basically, like, what is a sign? What is the sign of Erb's paralysis? Yes, I'm just writing here. It is policeman's tip hand, or else it is also known as the waiter's tip hand, or else remember one more name, it is also known as porter's tip hand, sir. That is a sign by which you will be able to identify the Erb's paralysis in the clinical conditions. Later on in the video, I will even tell you the reason for that one, like how it is happening and all. Don't worry about that one, guys. So for now, you remember the entire sign of the Erb's paralysis. Hope it is very, very clear. Now, what is happening in the Erb's paralysis, guys? In Erb's paralysis, there will be injury to which trunk? Upper trunk. Now, sometimes what will happen, even the lower trunk is also prone to injuries. There will be 3 trunks in the brachial plexus: upper trunk, middle trunk, and the lower trunk. So, if there is an injury to upper trunk, Erb's paralysis. Now, sometimes even the lower trunk will also be injured, and that will lead to another paralysis that is known as Klumpke's paralysis. So, Klumpke's paralysis. First of all, write down there, like, what is Klumpke's paralysis? Klumpke's paralysis is injury to lower trunk of brachial plexus. Injury to lower trunk of the brachial plexus, guys. Next thing is nerve root involved. What is the nerve root involved in the Klumpke's paralysis? And my students are expert in this now. We all know lower trunk is actually formed by C8 and T1. That is why what is the root value involved in Klumpke's paralysis? C8 and T1. And then next, one more thing here, what are the nerves involved? Which nerves are involved in the Klumpke's paralysis? The nerves involved will be your ulnar nerve and even the median nerve. So ulnar nerve and median nerve, these two are the nerves which are involved in the Klumpke's paralysis. And again, writing in the same sequence, what will be the sign? How you will be clinically identifying this one, sir? Remember, the sign for Klumpke's paralysis will be claw hand. Claw hand. So whenever, guys, the ulnar nerve and median nerve are involved, remember, ulnar nerve and the median nerve are the one which are supplying to all the muscles of the hand. And in the muscles of the hand, there will be like lumbricals and interossei. And when they are paralyzed, then what is going to happen? Your hand, like intrinsic muscles of the hand, basically are gone. They're paralyzed. Then what is going to happen? Your hand is going to become a complete claw hand, sir. It's going to become a complete claw hand. Now, in the exam or for the exam, you have to even remember the complete description of that. How will you describe the claw hand, guys? So just look here, and I request all of you to even do it along with me, guys. Okay. So take up your right hand like this. And in the right hand, we all know you'll be having like carpal bone, metacarpal and phalanges. And then you'll be having the carpo-metacarpal joint, metacarpo-phalangeal joint here. This is metacarpo-phalangeal joint. And then interphalangeal joints here, sir. Now, I'm keeping my hand straight here like this. What's happening at the metacarpo-phalangeal joint? So, metacarpo-phalangeal joint will be like extended. Fine. Now, it is flexed. So, this is like flexion and extension at metacarpo-phalangeal joints. Now, similarly, shift your concentration onto the interphalangeal joint here. Interphalangeal joint. I'm keeping the fingers straight here. So, therefore, this is extension, guys. And now this is flexion. So, flexion and extension at interphalangeal joint. Okay. And this is flexion and extension at metacarpophalangeal joint. And now, please try to make your hand like a claw hand. Okay. So, what's happening in the claw hand? In the claw hand, okay, first of all, metacarpophalangeal joint, it will be extended like this. And not only extended, guys, hyperextended. And then interphalangeal joint will be actually flexed here. And that makes your hand like a claw hand. Perfect. If you are doing it along with me, no need to mug up at all, guys. Let us do it again now. Okay. So what's happening? How to make the claw hand, guys? First of all, metacarpophalangeal joint here. Yes, it will be hyperextended. Hyperextension of metacarpophalangeal joint. And then flexion at interphalangeal joint. That makes your hand like a claw hand. No need to mug up at all. Okay. So let us write down here. So how is this claw hand made here, sir? hyperextension at metacarpophalangeal joint, MCP, metacarpophalangeal joint, and then there will be flexion at interphalangeal joints. There will be hyperextension at metacarpophalangeal joint and then flexion at interphalangeal joint. So I'll just show you the picture here. This is how it looks like. So you can clearly appreciate there hyperextension at metacarpophalangeal joint and then the flexion at interphalangeal joint, mainly involving the lumbricals and interossei, because your ulnar nerve and median nerve is gone, guys. Now one thing which is very much important here, guys, listen carefully now. Normally in a clinical condition, even the patients will come with just the injury of ulnar nerve and median nerve also. It might not be Klumpke's paralysis. Try to understand what I'm telling. I'm telling only about the nerve, not involving the complete root value there, C8 and T1 and all. In clinical condition, the patient can even come just only with the ulnar nerve and median nerve injury also. Then how will you differentiate that only ulnar nerve and median nerve injury with the Klumpke's paralysis? How will you differentiate that one, guys? Why? Because even in Klumpke's paralysis also ulnar nerve and median nerve is involved. Then how will you differentiate that one? Yes. Try to concentrate at this one here, guys. That is T1. In Klumpke's paralysis, the root value that is involved is T1. And remember, T1 is actually a sympathetic one. I hope you all know the sympathetic outflow. Sympathetic outflow will be thoracolumbar outflow. The thoracic spinal nerves and the lumbar. So T1 is actually the first sympathetic nerve, guys. And that first sympathetic T1 is actually the one which will be supplying, okay, via the ganglion here to your face, ipsilateral side of the face, guys. And because of the involvement of T1 here in the Klumpke's paralysis, it will lead to that Horner syndrome. It will lead to Horner syndrome, guys. I hope you have learned about that ptosis, and all those things. So please mention there, in Klumpke's paralysis, you will also see the Horner syndrome. Why? Why? Because since the T1 is actually involved, sir. The T1 is involved, which is actually the sympathetic contribution. So because of the involvement of T1, there will be Horner syndrome. So if a patient comes to you tomorrow in the hospital with ulnar nerve and the median nerve injury along with Horner syndrome, then it is Klumpke's paralysis. If there is no Horner syndrome, there is no involvement of that one, T1, then it will be only plainly ulnar nerve and median nerve injury, guys. So that is how you are trying to keep a clarity between these two. So how to find out clinically it is Klumpke's paralysis? So you have to find out ulnar nerve and median nerve injury, that is your claw hand, along with the Horner syndrome, that is Klumpke's paralysis, guys. I hope that clears the thing. After completing the Earth's paralysis and Klumpke's paralysis, welcome to the last and final applied aspect. And that was recently given in the exam as an image-based question, guys. Look at this image now. Now, in this image, you can see scapula, your shoulder blade scapula is prominent. And this condition is actually known as the winging of scapula. And many a times this has been given as an image-based question. So write on there the last and final applied aspect. Winging of scapula. Now, what is the nerve involved here, guys? Remember, winging of scapula will occur due to injury to long thoracic nerve. Are you all able to recall this one? Long thoracic nerve is the one which will be supplying to serratus anterior muscle. And serratus anterior muscle is the one which is actually required for punching and pushing movement. So it means that if this long thoracic nerve is involved, that means serratus anterior muscle will be gone. And if this patient comes to you in the hospital, then what you are going to do? Ask the patient to push against something, guys. Understanding? And when he is trying to push, what is going to happen? Because that serratus anterior muscle is gone there, it is paralyzed, it's unable to keep that scapula bone on the rib cage, on the thoracic wall. Normally what will happen? The serratus anterior muscle, it's trying to, keep that scapula along, attached to the thoracic wall, rib cage. But now what is going to happen? Long thoracic nerve is gone, serratus anterior muscle is actually paralyzed, so it's unable to keep that scapula along the rib cage there, along the thoracic wall there. Therefore, just ask the patient to push like this, automatically you'll be finding that the scapula bone will become prominent. That is known as winging of scapula. But nowadays in the exam, they're asking the questions in more depth. Not only that bone, they're asking about the border, guys. like which border of the scapula is going to become prominent. Understanding? So remember, scapula is actually a triangle shaped bone there, guys. There will be a medial border of the scapula here, and this here will be the lateral border of the scapula, guys, and this here will be the superior one. And in the diagram you can very clearly see there, okay, yes, which border of the scapula is becoming prominent. It's the medial border. Medial border of the scapula becomes more prominent there, guys. So write down, winging of scapula, it's due to injury to long thoracic nerve. And what is the sign here? The sign here is the medial border of scapula becomes prominent. So the medial border of the scapula is going to become what's more prominent. Okay, that is about the winging of scapula. And one more thing I'll tell you here, winging of scapula can occur due to some other reasons also, guys. Involvement of your trapezius muscle here and even the rhomboids and all. But mainly whenever we are speaking about winging of scapula, it's pertaining to the long thoracic nerve and the paralysis of serratus anterior muscle, guys. Mainly, more commonly, it is about the long thoracic nerve only. But there are certain other reasons also. I'm not denying that one. Is it okay? And this completes the entire thing, the normal brachial plexus as well as the injuries of that one, guys, like Erb's paralysis, the Klumpke's paralysis and the winging of scapula. So normal brachial plexus along with the applied aspect has been done here.